Can I ask what any of you might think about the impact on healthcare for the upcoming budget?
Nice segue.
Dr. Swann. I didn't want to.
I don't think money has been the problem in the healthcare system. I think it's the management of our resources, the top-down decision-making, the single super board that's now reflecting itself in a gross mismanagement in our EMS services, and we'll hear more about that today. The other health dimension of poverty is that we're going to see more and more people attending hospitals and getting into problems in the social systems because of poverty, and I don't see an ability now of the Premier to deliver on her 5-year promise to end child poverty, so we'll be going after her on that. Child labor standards in farms has been a big issue for me and continues to embarrass most Albertans that we are producing unethical food in this province as a result of the failure of government to put in basic regulations.
What do you think we're going to see in terms of stable long-term funding for the healthcare system? The healthcare system that was promised a couple of years ago.
Well, it appears that their plan B is private options. And as a number of people from the East have commented, we have the laxest regulations regarding boutique medical clinics and private options for people, whether it's testing or treatment. And that's part of what I think Albertans are waking up to, is that we are developing a stronger and stronger private alternate healthcare system.
And I think too, Kim, that answer's already been given. They trotted out the head lackey from AHS a couple of months ago saying he was okay with less money. You know, they've already got the ducks in the row on that one.
Kim, it's been pretty clear. They had 5-year sustainable, predictable funding. They're going back on that promise. They've cut home care. That's leading to people coming to emergency. With the private long-term care, more seniors are coming back into hospitals. You're going to find a very scathing report from the Health Quality Council this afternoon on EMS. They're not meeting the targets. In many life and death instances and life-threatening emergencies, for the ambulance even getting to your house on time, they're not meeting their 8-hour healthcare target and getting admitted people upstairs. And now they're going to cut. They're cutting in the wrong areas. They have to invest in more home care, more public nonprofit long-term care. And Redford's biggest promise, Redford's going to break. Her promise was family care clinics. Personally, we need family doctors who work with a team of health professionals. She's elected to start a war with Alberta's doctors and not let Alberta get access to primary care. So how is Redford going to fulfill one of her major key promises of getting Albertans' families good care?